Hello and welcome to A Healthy State, a series where I talk to doctors and other health professionals about important health topics. I'm Dr. Nelu Simmons and thank you for joining me. This episode is about rural health. Around 7 million Australians, that's about 28%, live in rural and remote communities. These communities face more challenges because of their location, including limited access to healthcare, and therefore there are higher rates of injury and hospitalisations. Conditions such as arthritis, asthma and diabetes are very prevalent in these remote areas, and interestingly, mental health conditions are less common. In today's episode, we will look at some of the key differences in rural health and explore the barriers to healthcare. We will also discuss some options for people living in rural areas to access health. Thank you so much for joining me today, Dr. Hamad.
You're most welcome. It's a pleasure.
Now, as previously discussed, there are a lot of logistic barriers in rural communities. Can you please talk us through some of the options that people living rurally have to access healthcare?
During COVID, it became very clear that one of the tools that we weren't using as much as we could have has been virtual healthcare or telemedicine. And so although I had been using telephone calls to talk to my patients and their GPs from Sydney, it wasn't something that was recognized as a clear strategy to bridge the gap between what we are able to deliver in a metropolitan area versus rural regional services. And so telemedicine and telehealth has really come a long way since the COVID pandemic because we've started to get used to it. And I'd like to encourage patients in rural regional areas to request that, or at least to pursue that if it means they get access to care, rather than feeling like they have to make a flight to Sydney or a flight to a city centre to get healthcare.
And what are some of the best ways to go about setting this up? Is it through a GP or finding a clinic that offers telehealth? Is it widely available?
It's not necessarily always widely available, and it may be that the clinician or the doctor that the patient is trying to see may not be trained or has the tools or the resources to offer that service. So it is possible to talk to a GP and ask specifically for doctors or specialists that are able to use telehealth or virtual care. GPs are very good at figuring out who's able to do that, who's not. Certainly, if it's something that you want to discuss with a current specialist that you see, then you can ask and say, is it possible for you to see me virtually or by telemedicine? There's no harm in asking. Nobody gets, flustered or feels bad when you ask the question, but I think it's worthwhile asking.
I've done quite a bit of virtual emergency myself in paediatrics, and I found it quite surprising how much you can do over a video, because we're very trained to be very hands-on and examination focused. As a cancer specialist, how have you found this with video medicine and FaceTime?
Like everything, every technology has its place. It doesn't completely, replace what we normally do in day to day, but it certainly can be used to cover a gap that we know already existed. So during COVID, I was able to look after a number of patients with blood cancers completely remotely because we couldn't even fly there. We couldn't travel to see our patients like we normally would, examine them, talk to them, shake their hand, comfort them with, a tissue or what we would normally do in a clinic room. But at the same time, we were able to still pursue treatments that would save their lives. And you can make do. It's not necessarily going to work as the only way to treat a patient, but it has its place. You can use it when you need it. You can bridge the gaps in the times that you can't fly out to that location or they can't fly to you, so that there are no big gaps in their care over time. It has definitely really changed the landscape, I think. And, like every technology, you have to use it the best way you can rather than replace what we used to do entirely.
Yeah, absolutely. Now, as a specialist, I assume you need to use GPs who live locally to families quite a lot to help bridge that gap, so to speak. Is this true, and what can you recommend for families who are in this situation?
I absolutely think so. I think, the GPs that are local have been absolutely incredible. They're incredibly skilled in rural regional medicine because they can do many things that, because they need to. Compared to my metropolitan counterpart GPs, they have a connection with the community, with the families. It's really deep and runs for a very long time. And I think, empowering the GPs to support the community is what I feel is really important, rather than taking, all of the care as a specialist, because I'm not there. So in an emergency or at a drop of a hat, usually it's the GPs that come to these patients' aid. And I think that, the relationship with the GP is one of the most important when we're doing outreach services. I would say to patients and families in rural regional services, your GPs are doing such a good job. It's worth trusting them. It's worth engaging with them, getting them to help you get what you need. There is no need to rely entirely on, services that are really far away from people with very subspecialized expertise. That definitely has its place. But, making sure that relationship with your GP is strong is really, really important.
Oh, fantastic. We're hearing from a lot of GPs in this series, so I'm sure they'll be very happy to hear you speak so highly of them. Finally, as you've mentioned, families do a lot of accessing their healthcare from the regional and remote settings, but occasionally they will need to come to the big city hospitals for treatments or for reviews. Are there any services available for these families who have to travel a long distance to access healthcare?
Yeah, so there are government programs that subsidize the travel and care for the patient themselves, and sometimes the carer if that's required. And when they access specialist services, it's up to the patient to provide the clinician with that request that they want support to do that. And clinicians are more than willing, I certainly am, to fill out all the forms that are required for them to access that funding, so that, it's not a burden financially. Sometimes you actually have to ask, and sometimes GPs need to let you know, but there's no harm in asking. Anytime you are in a disadvantage financially, raise it with your healthcare professional, and they can point you in the right direction to get the supports you need to be able to access your healthcare. Okay,
so it sounds like there are a lot of supports in place for patients who are living in these more challenging geographical locations. So thank you so much for going through some of that, and I hope that our viewers have found this helpful.
You're most welcome.
Joining me now is paediatrician Dr. Manish Agarwal. Dr. Agarwal is a lecturer and works in a regional hospital. He works as a consultant paediatrician and manages sick children from newborns all the way to 18 years of age. Being a rurally based doctor, he manages and follows up very unwell children with a whole range of medical problems. Thank you so much, Dr. Agarwal, for joining me today to share your expertise.
Thanks for having me.
Now, being a specialist in a regional centre, I'm sure this gives you a different perspective of medical care. What are some of the differences you have found in healthcare in the rural setting?
Yeah, so we all know that about 28% of Australian population lives in rural, remote Australia. And there are a few challenges in these geographical locations. So I think some of those challenges are increased rate of hospitalization, increased rate of injuries, death, poor access to primary healthcare services. People in rural regional areas probably are not aware of cancer screening as compared to their awareness in the metropolitan region. I think one of the other factors in health inequalities that I'm aware of are difficulties in accessing healthcare professionals, especially the specialists. There aren't many specialists who want to work in rural, regional, remote Australia. So people have to travel long distances to see them. There are issues with low income, low education levels, limited employment opportunities. And then I think there is increased risk of tobacco smoking, alcohol use. So all those things can cause significant health issues in people living in rural, remote regions. We all know that during COVID times, people with chronic conditions living in rural, remote regions, they had difficulty accessing resources, in their area. People living in metropolitan regions had probably better access to all the resources as compared to the ones living in rural Australia.
You've already answered my question really about what some of the barriers are to accessing remote healthcare. Apart from distance and workforce issues, are there any other barriers to people in regional communities accessing adequate healthcare?
Yeah, so I think there are a few more. As I said, limited availability of specialists is probably one of the biggest barriers, but cost of seeing a specialist and also lack of private health insurance due to affordability issues can be a big barrier, because these people, they can't go to see private specialists, they can't go to private hospitals, and then they have to rely on public system. And that leads to long wait times. And by that time, patient's health can deteriorate. So significant impact on their health. Also, the challenges of people living in rural remote regions when they don't know how to use telehealth platforms. Some people don't have access to internet, Wi-Fi. I think a lot of people with chronic health conditions have to do multiple visits to outpatient healthcare facilities. They have to rely on transportation when there is, if you are living 300 kilometers away from metropolitan region, you won't have access to buses or trains. So all those things really feed into the health outcomes. And a lot of people do feel scared to drive in metropolitan regions. Just traffic, too overwhelming, parking can be an issue. I think the other important barrier is workforce shortage and burnout. In metropolitan region, you find a lot of clinicians, a lot of practitioners who would love to be there. In any given hospital, you'll have so many people working in a department, whereas in rural remote regions, you have very few working. And then whoever is working, there is so much of workload, it can lead to burnout and fatigue in them. I think lack of good infrastructure and lack of good schools is an important factor in retaining people in rural remote regions. Also, poor health literacy is the other barrier, according to me. People find it very difficult to understand health information and instructions given to them and follow those instructions given to them by their healthcare provider. And this is because of low level of education and higher incidence of poverty. And I think one of the other biggest barrier in my mind is social stigma and privacy issue around going to the hospital, because you never know who you're going to meet in the hospital. Someone who might be a friend. So I think there is a significant problem around privacy concerns, especially if someone wants to access help for mental health, substance abuse, sexual health, pregnancy, and even other chronic illnesses. Yeah, so these are a few barriers that comes to my mind.
Gosh, so many different things to think about that we may not necessarily appreciate. Thank you for outlining some of that. Now, on the flip side, what are some of the benefits for people living in these areas when accessing healthcare?
Yeah, so good question. I think there are lots of benefits to health in general. For example, when you're living in rural areas, you're surrounded by trees, you're surrounded by nature, there is lots of activities you can do. There is less exposure to pollution, less exposure to noise. Your lifestyle is relatively calmer, kind of slow-paced lifestyle, reduced stress level. So I think a lot of advantages, and you can only imagine these advantages are going to help you with good health. During COVID lockdown, a lot of people wanted to move to rural, regional Australia because they wanted to avoid large crowded places. And I think there is a reason for that, because nobody wanted to be sick, nobody wanted to be unwell, nobody wanted to be in the hospital. So I feel living in rural areas can bring less social pressures as well. So then you have more time for yourself, more time for your family, more time for your kids. You can do exercise, enjoy some green space. So yeah, massive health benefits provided you use it properly.
Yes, absolutely. And as a doctor, from the medical perspective, do you see benefits for patients living regionally into sort of healthcare patient relationship?
Yes, I do. So I've been a regional doctor for the last 10 years. I moved to a rural coastal town in 2013. And at that stage, I wasn't sure what the life is going to look like. I was there just for 1 year, and I wanted to go back to Melbourne as soon as I can. But once I was there, I loved living in the rural coastal town. There was excellent work-life balance, not much peak hour rush, no traffic jam. Easy to drop off kids to school, go to work, everything done within 10 to 15 minutes. You want to pick up your kids, drop them back home, come back to work. Again, within 15, 20 minutes, it's all done, and you can carry on with life. So I think that was good, not getting stuck in the traffic for 2 hours of your precious life, a day. So a lot of benefits of working in rural regional Australia. Also, when I lived there for almost 4 or 5 years in this rural coastal town, with the weather change, if it was too warm, it was too windy, you can just get onto the ocean, you can enjoy the beach, you can get onto the waves with your family. So it was pretty good. I don't think we can have that luxury living in major metropolitan cities. I think the other advantage I feel is you get to live in nice, spacious, bigger houses. You can buy a bigger house for less money, and also less exposure to communicable diseases like COVID-19, which I think people are too scared of. There is reduced cost of living because you save a lot of time in your travel, so less money spent on fuel. There is stronger sense of local community, relaxed pace of life, and I think just in general, you feel proud of being in that area, supporting communities. People get to know you very quickly, and they do appreciate your presence, value your opinion. And I think in general, there is a great sense of pride to be part of the rural community. So a lot of advantages.
Well, I think you're selling the regional life to all of our viewers. Now, thank you so much.
Yes.
Thank you so much for outlining some of the barriers and the benefits of living regionally. I mean, it sounds like, like you said, 28% of the population living regionally, this needs to be a priority. Do you think it's a big enough priority in healthcare, or is this something that we really need to see more of a push towards?
Yeah, look, I think it is a big priority because as an Australian, we all live in a society wherein we pay the same tax. We vote for the same government. We expect equal benefits and equal opportunities to have the best healthcare, no matter which part of Australia you live. I understand there are so many barriers, but I think the frustrating part is that most of the help and support and resources are concentrated in the metropolitan and maybe outer metropolitan region. So I definitely agree that there is a need to do more for the rural regional community, and also giving incentive to specialists and practitioners to go and work in the rural remote areas, having some special allowances, special incentives, relocation allowance, retention allowance. I think one of the ways it can be done is promoting telehealth. There could be more promotion of patient support system like social work and other support services. I know there is a patient access travel allowance scheme, but I'm not sure if that's good enough for the people who have to travel 300 kilometers to see a specialist. I also think there is a big role of nurses in the rural regional Victoria, because I don't think it can just be doctor dependent. I think more than doctors, there are nurses and other important people in the healthcare system who do contribute to these regions, and promoting nurse practitioners and expanding their scope of practice so that they can prescribe, they can order some diagnostic tests, they can have easy access to doctors, and also they can do it under medical supervision through remote access. I think having direct affiliation to larger hospital systems and network might also make life a bit easy for rural practitioners to get more supports. It's always daunting for someone, especially a new practitioner, to go all the way in rural remote region and work without having much supports around them. So having a nice robust system might make them think about it. And I think infrastructure changes in some of the regional rural areas might really help to keep people. Otherwise, it's pointless that people go and work for 1 or 2 years and then they move back to metropolitan region.
Gosh, so much there to think about. Thank you so much for sharing your insights and your expertise, Dr. Agarwal. Really appreciate you joining me today.
No worries. Thank you. Thank you for having me. Thanks.
Thank you for watching A Healthy State. I hope you found the information helpful. This episode and the rest of the series is available to stream on CTV+. I'm Dr. Nelu Simmons, and I'll see you next time.